Hi, my name is Taposhi. I am a high school physics teacher and I identify as an autistic woman. And I'm just going to share a few things that I do to take care of myself and why it's so important for me to do that. So, one of the big things that I've learned to do, even since I was a child, and that my parents helped me do as well, even though we didn't necessarily know I was autistic at the time, is just making sure that I get breaks from all of the sensorily demanding things that happen in the course of a normal week. So, school, whether as a kid or an adult, is very sensory high, very socially high demand. And so, during the weekends, in the evenings, I try to make sure that I am budgeting out my social energy and how much I actually am exposed to people. So sometimes, like on the weekend, we can really only handle one big social commitment, and that has to be okay. I like to make sure that I'm following a pretty consistent routine when dealing with food, sleep, drinking. My body does not always tell me very reliably or recognizably when I'm hungry or when I'm thirsty or when I'm tired. And so just having a plan to do that and to take care of those needs throughout the day instead of waiting for, oh, well, I'm sure when I feel hungry, I'll stop. I might not. And I know that about myself. Things like weighted blankets, acupressure mats, acupressure rings, these are all things that are available much more readily now, I feel like, than they were when I was a kid, and they are so good at like diffusing the sort of physical sense of stress that I get from just existing in the world each day. And then it's really important that I can do these things because if I don't, I kind of lose access to a lot of the things that make me me. Yeah, I've learned to do these things. They're little things. They don't take a lot out of my day. I don't think they are that much effort, but if I don't do them, then there's big consequences later. So I try to make sure that we do it. So thanks for listening.